Hi, my name is Szakal, and I will be discussing my evidence-based project today with you guys. So first things first, I would just like to discuss my topic is oral care first line against preventing infection. So the journal that I chose to potentially submit my article to is Nursing Made Incredibly Easy. It's a Lippincott, Williams, and Wilkins journal, and it's a book series that was made for nurses. It was based off the original series called Incredibly Easy. The point of this journal is to have a place where nursing and nurses can go and look into different research topics as well as practices, and it's broken down into a simpler form and that's easy to read, easy to understand. So a little bit about who I am. I have been a nurse just under 3 years now, and I have worked in an intensive care unit the entire time. Very fortunate for that. Most of these patients, a lot of them, at least a majority, are intubated patients, and a huge part of an intubated patient has been pressed into me from my first days as a nurse about oral care with these patients. And the importance of such. We used to have at my first job these care kits. They were like Q2 hour ones and Q4 hour oral care kits. And every 2 hours you would just break off the next section. And I always found them very interesting and very important. It just seemed that with that, it went unattended sometimes. So having worked in just an intensive care setting my entire career so far, I have picked up on oral care and the techniques that are there or lacking. And that's kind of where I started this journey, was my OCD on making sure that people's mouths are clean and ensuring that our patients are getting the best care, even if it's something simple as brushing their teeth. So why oral care? Like I said previously, I'm kind of big on the oral care in the sense that our patients, especially when intubated, cannot provide such tasks for themselves. It's a huge liability and risk for patients, and they can get an infection. This is seen for the simple fact that the health of your oral cavity and overall health is based on your oral care. This is stated in one of the articles that I found, and it also helps reduce the incidence of pneumonia as well as ventilator-acquired pneumonia, which typically in the intensive care unit, we see a lot of ventilated patients. And you do this by using oral care, which allows you to decrease the amount of bacteria within the mouth. So yeah. Part of this oral care journey has been quite interesting to realize the attitudes towards it as well, and that as a nurse, we have a lot on our plate. So sometimes the simple act of oral care seems like something that, can get pushed off to the next group or whatnot, and it's definitely something that we all can improve on. So for my project, I sent out education to my unit based on oral care and the needs. So my project has actually gone a little sideways throughout this entire process. I found out through doing some research and looking into this topic that my hospital does not record ventilator-acquired pneumonia. Whether that started last year because of COVID, I don't know. And it was very difficult to find those numbers because originally I was going to send out education and look at the numbers prior to the education of ventilator-acquired pneumonias, and then after education, look at those numbers. So that kind of got changed up. So now I kind of just looked into the education that I've provided, and that's another reason why I like the Nursing Incredibly Easy journal, because it's just a simple step of simple things that we can do to help with oral care. So the first thing that I sent out to my unit was a little brochure I made called Oral Care, the Effect on Pneumonia Rates in Our Patients. It's just a simple how-to of what pneumonia exactly is, steps that we can do to help, the simple steps of whether a patient is ventilated or awake, and just kind of assisting and reminding them the importance of oral care and their health. And then just a little section that discusses skepticism and looking at the research. There is a lot of research out there that shows that teeth brushing, tongue brushing, and actually using the addition of chlorhexidine helps decrease the numbers. As well as that brochure, I did send out 2 different articles to my unit, one of which was discussing the principles of the effectiveness of oral care, and it kind of goes through in this article and shows you the different steps of your oral assessment as well as the steps of giving proper oral care. Another article that I found, and I actually found quite interesting, discussed nursing attitude and knowledge and whatnot of oral care in different parts of the world, actually. And it was quite interesting to see a lot of people have a positive attitude and actually decent knowledge. It's just whether or not we're putting it into effect. So I think that 200% accountability kind of goes into that, and making sure that we kind of discuss that with our ongoing care of patients. So in conclusion, this has been a very interesting project. It's taught me a lot. And I hope to continue to help my unit and other nurses in realizing how important oral care is, and to continue with the research. Thanks, guys.